If you have federal employees' health benefits known as FEHB, this video will be very, very helpful for you. The FEHB program is for federal employees, retirees, and their survivors. See, a federal employee is anyone that's worked for the federal government at either local, state, or national level. Federal employees are among the most secure, and they carry some of the most impressive benefits that you don't see in the private sector. At the local level, examples can include being a police officer, a firefighter, or even a land surveyor. At the state level, examples can include being an elementary school teacher, a records clerk, or a civil engineer. At the national level, examples can include a U.S. postal worker, an FBI agent, or an aeronautical engineer. This is really key right now, is that railroad workers are also considered employees of the federal government under the Federal Railroad Administration system. So if an individual worked for the federal government, they would have access to FEHB. This individual does not need to speak to an insurance agent since they already have the federal government's insurance that is being made available to them. So again, if you are a federal employee, you do not need to speak to an insurance agent. For someone to keep FEHB after they retire, they must be enrolled in FEHB for at least 5 years to be eligible to continue that coverage. Someone allowed to keep their FEHB when they turn 65 does not necessarily need to enroll into Medicare Part A and/or B. There are 3 options an individual will have when they have FEHB when they turn 65 that we're going to look at so that you are familiar with this as a federal employee. Number 1, the first option an individual has is they can keep their FEHB as their primary insurance and continue to pay their monthly premium for that plan. They should enroll in Medicare Part A since it's free at 65 because it could help them pick up some hospital expenses under their FEHB plan. There is no need for Part D since the FEHB includes prescription drug coverage. A benefit to not enrolling in Part B would be that they would save the $148.50 premium a month, which is standard in 2021. The downside is that not enrolling during the IEP, the 7-month initial enrollment period, the individual would not be eligible for a special enrollment period SEP if they wanted their Part B at a later date. The second option that an individual has is they can enroll in Medicare Part A and B as the primary insurance, and the FEHB will be their secondary insurance like that of a Medigap supplement plan. There will be no need for a standalone Part D since the FEHB includes prescription drug coverage. The individual will need to pay the standard Medicare Part B premium of $148.50 in 2021, as well as the premium for the FEHB plan. This would give the individual the most comprehensive coverage and leave them with very little out-of-pocket expenses. This would also give the individual coverage through Medicare for things like some orthopedic and prosthetic devices, durable medical equipment, home health care, chiropractic services, and some medical supplies that some FEHB plans may not cover. The third option and final option an individual that has available to them is they can enroll in Medicare Part A and B and suspend their FEHB plan. If they cancel the FEHB plan, they will never be able to get it back again in the future. The individual, though, can always take back the FEHB plan during their open season each year, which runs between November 9th and December 7th if they ever suspend it. So the only reason an individual would want to suspend their FEHB would be to either join a group health insurance plan or maybe try and help lower their monthly premium with a zero premium Medicare Advantage plan. So in conclusion, when it comes to FEHB coverage, an individual that is eligible for FEHB is not required to take their Medicare Part A and/or B and pay that standard monthly Part B premium $148.50 in 2021. The individual needs to decide, though, which of the 3 options that we just went over works best for their needs. The individual does not need the services of an insurance agent for either a Medicare Advantage or a Medigap supplement plan.